Hello, everybody. I'm Anthony Gonzalez, and I'm the program coordinator for the Higher Education Center for Alcohol and Drug Misuse Prevention and Recovery. I want to welcome you all today to our webinar titled Harm Reduction in the Collegiate Setting, Implementing Practical Evidence-Based Programs and Policies, featuring our presenter, Dr. Nina Christie. Before we get started with today's session, I do just have a couple of housekeeping slides I'd like to share with everybody. We do have the Q&A enabled today, so we do welcome your questions at any time throughout the live session, but we do kindly ask that you utilize the Q&A feature. We also have the chat enabled, so feel free to introduce yourself and share reflections and resources as it relates to the presented content. But again, we kindly ask to please utilize the Q&A feature for your questions, just so we don't lose track of them. We also have captioning enabled for today's session. If you have any issues getting that set up, please just send me a message and I will try my best to walk you through that process. We encourage everybody to learn more about becoming a member of the Higher Education Center. You can learn more about the different membership tiers and the benefits that go along with them by visiting our website at hecaod.osu.edu. I would also like to share a couple of upcoming events that we have taking place. We have our Spring Learning Collaborative taking place currently, and the next and fourth session in that series will be taking place next week on April 3rd, and is titled Fostering Community Wellness, the Collaborative Approaches to Harm Reduction in the Collegiate Setting. We also have a water cooler chat taking place on April 9th, and will be focused around preparing students to leave campus for the summer. We also have another webinar taking place on April 18th, and we'll be focusing on the impacts of the justice system involvement on college students in recovery. And we also have the 2024 national meeting taking place here in Columbus at the end of July and the beginning of August. We'll have a simultaneous virtual offering going on. Additionally, our call for mini sessions is open and extended through April 15th if you have a session that you would like to submit. And with that, it is my great pleasure to turn it over to our presenter today, Dr. Nina Christie, a postdoctoral research fellow at the Center on Alcohol, Substance Use, and Addiction at the University of New Mexico. Thank you for joining us, Dr. Christie, and it's my pleasure turning it over to you at this time.
Great. Thank you so much for the lovely introduction, and it's so nice to see everyone filtering in as well. Those next talks look very fun as well, especially the next one, which is really related to the one that I will be giving today, which is great because they will also be focusing more on some of the community aspects that I only touch on a bit here. So yeah, with that, hello, everybody. My name is Nina Christie. As Anthony said, I'm a postdoctoral research fellow over here at the University of New Mexico in Albuquerque. And we're going to go ahead and chat about some work that I did in collaboration with the William G. Nash Foundation, as well as Students for Sensible Drug Policy, trying to create a harm reduction handbook for institutes of higher education to be able to implement some of these evidence-based strategies in their own campus institutions. So as a refresher, we have some objectives for the session today. The first one is really going to be trying to give you the kind of the ability to articulate and apply some of the fundamental principles of harm reduction as a philosophy and as a practice, and really applying that to the collegiate health setting. The second one is to be able to identify how to effectively collaborate with kind of different stakeholders involved in this space, including people within and external to the university. A third one is to really try to match the program goals, like these different harm reduction programs, with the needs of your particular campus. And the last one is going to be a bit of a workshop where we actually go through some of the harm reduction programs and policies and identify at least one that you think might be suitable for your own collegiate environment. So to start us off, I wanted to do something a bit interactive. So I have an open-ended question here, which I think maybe will be a poll. If we set that up, great. Okay, it's there. So just in a short answer, you can answer like, what does harm reduction mean to you? What do you think it means? And I would love to see your thoughts. And then I've not used this feature on the panelist side before, so I'm not totally sure when I'll be able to see what everybody is writing, but I believe Anthony will be able to help me with that.
Yeah, I'll leave it open for just a few more seconds and then we'll end it, and I think we'll be able to share the results.
Great. That makes sense.
All right, I'm going to go ahead and close it and then share these results. Are you able to see the responses?
I'm not. I'm able to see 100% answered.
Mm.
Are you able to see the responses?
No, I am not.
You have to click view details, which I don't know if that's just on the panelist side or not.
I only
All right. Yep. I am having technical difficulty. I will continue to try to access it.
Okay, that's no problem. If people want to just put it in the chat as well, that's more than okay. And just like a couple of words is fine, but we'll all start chatting about what they mean. And so I do hear some background noise coming from somewhere. Okay, there we go. All right. So harm reduction, all right, there we go. Thank you. Reducing risky behavior, reducing risk among people using drugs and alcohol, safer, healthier options, more broad, avoiding negative consequences, keeping people alive and safe, autonomy. We'll be talking about that a bit. Health in the quotes. I like that. And people have different goals in reducing risk. So I'm starting to see some kind of common themes here about less negative consequences, autonomy, giving people access to tools and information to help them make decisions that are in line with their own goals, which is exactly what harm reduction is. So we have some knowledge already coming in. One that I really liked was one of the more broad definitions of just like reducing harms more generally. And so the reason I include that is because harm reduction is kind of like all around us in public policy and human health and behavior and all of these things. And so seatbelts were a really big harm reduction measure in the 80s. When I give this lecture to college students, no one remembers pre-seatbelts. I don't really remember pre-seatbelts, but I like remember some lingering conversation about it among older family members. And so for those of you that were around, like when seatbelts became mandated in all new cars, it was not this very smooth process where everyone agreed, yes, seatbelts, great. We're going to reduce harm. People were really upset. They were angry. They were like, you can't tell me what I have to put in my own car, those sorts of attitudes. But now seatbelts are widely used. You have to use them in cars. And I think school buses now have them. When I was growing up, not necessary. So that was also kind of frightening. It's like the only place you don't need a seatbelt is a bus full of children. But I think they have seatbelts now, at least from when I was a camp counselor. So that's one example of harm reduction. Another one would be like safer sex practices. So condoms, STD testing, access to information. States that have abstinence only education for sex education do have higher rates of STDs and STIs among especially adolescents. And that's what we see with substance use as well. People that don't have access to balanced information on how to be safe are not as safe, and that shouldn't be that surprising. And so more recently, and what we're going to focus on today is harm reduction for substance use. And so this, fentanyl test strip is just one example of harm reduction for substance use. And so for the talk today, we're really talking about practices that reduce the negative consequences of drug use and other potentially risky behavior. And so I just want to give a little background on harm reduction, like what it is. It is a philosophy. It's also a set of practices and policies and programs, but at its core, it really is a philosophy. And it was born from like grassroots organizations. So if you look at Drug Policy Alliance's website, they say that it's from everything from like the 70s with the Black Panthers all the way through the HIV epidemic of the 80s, where harm reduction kind of became more nationally recognized. Harm reduction at its core is also non-judgmental and non-stigmatizing, so really focusing on autonomy, as several people brought up. A common phrase you'll hear is meeting people where they are. And so that has to do with, again, autonomy and like having people describe their own goals, and rather than imposing your belief system or goals or policies on them, having people really have a say in what those are going to look like. And of course, it's mitigating harm, as the title would imply. If you want more of a more in-depth background on the history of harm reduction, Maya Solovitz wrote a really great book, Undoing Drugs. Came out like a year or two ago. Would highly recommend that if you're interested in understanding more about like the background of harm reduction and how it's come into play in society today. And so the goals of this are to reduce the negative consequences associated with drug use, including disease, death, and other consequences. And also, I think what we don't talk about is like the flip side of this, which is basically the same, but to promote any positive change related to behavior and substance use. One story I always like to tell with this is I was working in a needle exchange in Skid Row when I was in grad school at USC, and this was so funny. I was handing this one of the clients there, I was handing him his needles, and he was like, I'm really excited. I have, you know, almost 2 weeks sober today. And I was like, that's awesome. But I was also a little confused because I was like, you're getting needles right now. But he said that he was only doing meth now and he had stopped injecting heroin. And he was really, really excited. And to him, that meant sobriety. And so that's still really exciting, right? Like poly substance use is more dangerous than single use. And it is a positive change to stop injecting heroin for his health and well-being. And that was his goal as well. And so really promoting any positive change is what harm reduction is all about. Providing support for people using substances that's not necessarily just about the substance. So a lot of harm reduction centers also have social workers and people that connect clients to, like, you know, wound care or social services so they can get an ID or get on a list for housing, things like that. And ultimately, the whole point is to keep people who use drugs safe, which someone else also wrote as their definition. And I also, just the last part here, I want to tie back into the front of it being grassroots, is that harm reduction is really a social justice movement that's advocating for the right of people who use drugs and do other risky behaviors. So harm reduction is a net positive. If we use evidence-based drug programs, we reduce the harms associated with drug use, we improve human health and well-being. Yay. The opposite of harm reduction is when we don't have these kinds of policies. We have a lot of silence, a lot of stigma, and a lot of punitiveness around drugs. We increase the harms associated with drug use. We increase shame and stigma. And we also simultaneously decrease people seeking help and information seeking on how to safely use substances. So given that harm reduction is kind of came out of these other places, it was really about marginalized groups. It was by and for people who use drugs and primarily people who inject drugs. And how do we apply this to a setting of higher education, right? Like, this is not the same population that harm reduction was designed by, and it's not really the population that harm reduction was designed for. And so I just want to give a little bit of a background on a couple of laws that pertain particularly to institutes of higher education and students who attend them. So has anyone here heard of the Drug-Free Schools and Communities Act? I'm not totally familiar with what people's positions are. You can just say yes or no. We got a couple yeps. All right, nice. A lot of yes. Oh, a couple, there's a no. All right, so this won't be totally new for everybody, but also is information people need to know. So the Drug-Free Schools and Communities Act, or DFSCA, is federal legislation that has not been updated since, I want to say, the late 80s, early 90s. And this is tied to how institutes of higher education get their federal funds. And essentially, it has two components in order for schools to maintain their federal funding status. And then it also has one rule. So the rule is that each program has to have implemented something to prevent the use of illicit drugs, and this is their language, abuse of alcohol by students and employees. And then they need to do two things with that information. One, they need to distribute it annually to all students, staff, employees, everybody. You probably get one of these emails from your university. I know the University of New Mexico one just came out a month ago. It's one that they use every year, and I found a typo in it. So that was really exciting. I was like, okay, this is a 2-paragraph thing, and yeah, it was a little frustrating. And then a second component is that there has to be a biannual review of the program. And what that means is that the institution is supposed to be collecting data related to either the sanctions, the use of illicit substances and alcohol on campus by students, or other negative consequences associated with this use. And different schools have different ways that they collect that data. Some of them just do like a survey. Some schools barely do anything. I'm sure some actually don't do anything. And other schools do a really thorough job of this and publish the results online, like Northwestern. And so this is something that, if you don't know if your school is doing, I think it actually could be really beneficial for the rest of the talk, because the whole point of this is to implement harm reduction programs and demonstrate that they are effective in reducing harms. And the strongest way we can do that is with data. And so theoretically, every institute should already have some sort of review of substance use policies and how effective they are. But the schools have a lot of latitude in terms of deciding what that review actually looks like. So the program has to include, for the DFSCA, like in the statute, it says that you have to have standards of conduct that prohibit the possession, use, or distribution of illegal drugs and alcohol. And then it also has to describe the following things here, like in very limited detail: legal sanctions, health risks, any counseling or treatment options, and any non-legal sanctions that the university would impose. And they do have to prohibit the recreational use of substances on campus, whether it's an age restriction thing like alcohol, or whether it's a completely illicit substance. There is some legal kind of battles that I won't get into right now with marijuana being federally illegal, but legal at the state level, and also federally acknowledged as not having any medical benefit because of its Schedule I status, but also being medically prescribed. So students that have a marijuana prescription are in kind of like a gray area, but definitely keep your eyes peeled for legislation coming out of that because it's very interesting. But one very important thing I want to note here is that harm reduction strategies are not anywhere written in the DFSCA. They're not prohibited in any way. They're not promoted. They're just not mentioned at all. And the reason I bring this up is because with SSDP, or Students for Sensible Drug Policy, that organization I've worked with, sometimes what happens when students want to implement these programs on their campuses is that they're met with like kind of resistance at the administrative level. And some people are being told that they can't implement these things because of the Drug-Free Schools and Communities Act and that they'll lose their federal funding. And I just want people to know that that is not true. And so that's not a concern if you're looking to make changes at the university level. There are many other concerns and things you should think about, but this is not federally banned. And the reason I want to talk about this now is because it's looking pretty grim in terms of overdose death rates among young people. These statistics are quarterly. So on the left side here, we're looking at early 2015 all the way up to late 2022. And these are unintentional drug overdose death rates. The red line is overall, the blue here is boys, and the purple is girls. And you see this huge spike during COVID. So like COVID hits right here, and that's where we see this accelerated line of overdose death rates. This is also when fentanyl became really commonly kind of found in substances that were not marketed as fentanyl. So pressed pills, cocaine, things of that sort, other opioids as well. And so even though students, and Gen Z in particular, are using less drugs than other generations, they are experiencing more harms than other generations. And so that's extraordinarily unfair, but also really concerning. And so harm reduction should be something campuses are doing to keep their students safe. One school I want to highlight that's doing really well is Northwestern. So they have a whole section of student affairs literally for harm reduction. So I don't have the website here, but maybe someone can find it. If you just Google Northwestern harm reduction, it'll pop up. But they have a nice definition of it. They talk about, on the side here, you can see know your limit, alcohol, cannabis, talk about medical amnesty programs, which we'll talk about in a minute, overdose prevention, and all of that. So students have access to these resources and they know that the university is promoting them. And so students will feel, yes, it is inspiring. Thank you, Anthony, for putting that in the chat as well. Students will feel like better knowing that their college or university has their best interests at heart and is not promoting fear-mongering, but rather education and support. And so another thing I want to remind everyone about is that college students are young and they are often naive to drug use. And so the middle part here is when, like, on average, the 50% of people who will ever use the drug have used it by X age. So for example, marijuana, 80% of this sample, 80% of this sample had used it in a lifetime, and 50% of them had used it by age 17. You'll notice that the 50% mark for most substances is this 18 to 21 range. That's when students are in college. And so what that means is that a lot of people are using drugs for the first time in college. And so we want to highlight that for educational purposes and also to show that people don't always know what they're doing. The first time you do something, you don't know what effect it's going to have on you. You don't know routes of administration. You don't know a lot of information that you probably should before starting. And so we know that college students use drugs, again, Gen Z less so than others, but they are experiencing more harms. And so on average, this is 2013, over 1,300 students will initiate any illicit drug use on a given day among college students. So that's a ton of people using something for the first time. And a lot of people in these situations don't necessarily know how to use safely. They're learning information from their peers or other people who may have done it before, but who may not, know exactly what it is that they're doing. So some substance use trends for Gen Z are increased polysubstance use, so use of more than one drug at a time. I showed you already the increase in the overdose rates among this population. We simultaneously, although we have a lower drug use percentage of students using, people are using different things. So like it used to be the case that alcohol and cannabis were the two most popular. While that still is the case, marijuana is like really getting close, and vaping is also extremely popular. And with the legalization of marijuana, we have this lowered risk perception of marijuana. So this is like a total 180 pendulum swing from the reefer madness days of the 70s all the way to like people that are so pro cannabis. They're like, oh, this is going to cure everything. If you have anxiety, just smoke weed, you'll be fine. Like that kind of mentality, which again is not the majority of people, but is like a noticeable shift in terms of risk perception around the drug. And we also have much higher potency THC products than we did before. So one of my colleagues at USC did a study on the THC rates in stores of like products that are being sold. And they tested the THC in each of the products that they bought. And over 90% of them were mislabeled. And not all in the direction of favor for the business. It wasn't like they were all less THC than advertised. Like it was all over the place in terms of, it was just inaccurate. So there's a lot left to be desired for regulation at this point. And so just being sure that people know what they're consuming is not as easy as just reading a label, because they're not always accurate. They're actually almost always inaccurate, which is not great for people who are looking for information. And then lastly, I want to show just like some of the psychedelic kind of increases we're seeing in terms of like national mass media as well as science media around psychedelics. So we have a ton of like shows and articles and books all talking about the benefits of psychedelics. And there is a trial going on where there's a stage 3 clinical trial already showing some efficacy for psilocybin in treating some mental health conditions, particularly PTSD and depression. And that's super interesting and should be studied, but we do want to be careful not to swing so far that we end up in a situation where people think there's no risk involved with taking psychedelics, because that's not true. And so young adults are using marijuana and hallucinogens at much higher rates than previous generations, even though they are drinking less. And so this is really important for harm reduction, because in order to make effective programs that are going to help people who are using drugs, you actually need to know what they're doing. And so right now we have a really big gap in our knowledge and our interventions for people who are using drugs that are not alcohol. We don't have a good like setting program for college students for psychedelics. We don't have a good tolerance metric for cannabis, things of that sort. And so we also want to know about the motives for use. So like what the reasons you're using substances impact in terms of like when you're going to use them, how you're going to use them, who you're going to use them with, and helping people to make smart decisions around that. We need to know what their motives are. And then lastly, particular to psychedelics and cannabis, a lot of students have beliefs around the ideas of like recreation. And then beyond that, people talking about like the personal values and ethics around these substances, it being part of their identity or part of some self-healing journey. And so we want to know about all of this because we want to be able to meet students where they are and give them information that helps them make smart decisions. And also give people information on some of the consequences that can be associated with substance use. So we do know that, use catch some, here, I'll explain this. Standard rates just means standard mental health disorder rates in the population. This middle blue circle is about people who use cannabis kind of casually, and they're at slightly over 2 times the risk for having any adverse mental health condition. And people who meet criteria for cannabis use disorder are 3.5 to 4.5 times more likely to also have a mental health problem. And so I want to highlight that because mental health is a big thing going on in the college population right now, with huge numbers of students reporting anxiety and depression and other problems. And people might not be linking it to increases in substance use, specifically for cannabis or other drugs. But it's something that we do want to keep in mind because like I was saying earlier, there is this lower risk perception for these substances that are specific to this like population. I can share the source. Oh, it should be on here. Oh, it's in my notes, that's why. Oops. I'll email it to you after, and then I'll write a note. Thank you, Laura. Okay. And then we also have some risk associated with hallucinogen use. We have higher rates of emergency department visits and hospitalizations in California for hallucinogens since 2019 and 2020. And so, thank you, Anthony. So for these ED visits, you can see that that's actually kind of blurry, but you can see that there's an increase going on for 2020, 2021. So it's the same COVID kind of bump we're seeing, but the problem is we're not really seeing a decline in the post-COVID landscape. We're seeing like somewhat of a lull. I mean, here it's only to 2021, but with other substance use, it kind of plateaus. It doesn't keep skyrocketing, but it's not going back down. And so this is something, again, we want students to be aware of, because the perception of risk and the actual risk, if they don't match, that is not a good recipe. So what are some actual harm reduction goals, policies, and programs that people have on campuses? There are many. First, I'll talk about 4 that are pretty widely available. These are used at a lot of universities nationwide. And then I'll go into the second half talking about ones that are available at some universities, but are not super widespread. Safe ride programs. These are awesome. About a third of public universities and a quarter of private universities have some sort of safe ride program. And these are really effective at what they do. They've been studied for decades, and they decrease impaired driving. That makes sense. They decrease accidents. They decrease DUI arrests. They don't increase alcohol consumption, which was a big concern when they first came out before we had good data on it. Was about like, oh, if students know that they have access to a safe ride, they won't drink as much. College students, it turns out, will drink the same amount whether or not they have a designated driver or not, which is concerning. They're also very cost effective. They save $3 for every dollar spent because of this like reduction in these other risks. And so these can look different at different universities. For example, the University of Connecticut has one called Guard Dogs. And so this is one that's like run by students for students. When I was at USC as a grad student, they partnered with Lyft. This was the first school I had seen that had done that. And every student automatically on their Lyft app, if they use their USC email address, gets free rides Thursday night to Sunday between, I forgot the exact hours, but like nighttime, like 10 to 2 a.m. Within a certain radius of campus. So like that was really integrated and smart, because that's like what students are already using to get around. And so giving people free rides at high risk times is good. When I was at UCLA, it was like a student run van. They would just do laps around the fraternity and bar area and drive students home. Another one is harm reduction education. So how many of you in here have been involved with a program like Alcohol EDU, or had to take it, or have interacted with it in some capacity? I've had to take it like 3 times. Very annoying. I feel like that, oh yeah, there was like an emotion behind that. Okay, so a lot of us are familiar with Alcohol EDU. And so that program it has its flaws, right? Like pretty much everyone here has been involved with it. Of course, it has its flaws, but it does teach people basic information about alcohol, which again, if you remember being 18, like you don't know what you don't know until you have been corrected. And so it's a good way to provide people with basic information on like what alcohol is and how it can kind of come out in these different ways. And a lot of other programs seek to implement like things called protective behavioral strategies. So these are things that people can use while they're using drugs or drinking that reduce the harms associated. So for example, alternating each alcoholic beverage with water in between so that you're getting less drunk and also staying hydrated, things like that. There's also this resource called Tea Break Guide, talking about getting a tolerance break for cannabis. And that's great. And I'm seeing some in the chat, which people are promoting other ones. That's awesome. I think we just need education for students, and people that have gone through harm reduction education programs. Over 90% of students say it influenced their approach to substance use in some way. And that's really like we don't see statistics like that a lot. And so it's very exciting to see that a lot of students are actually learning something from these programs. Even if I think what we end up seeing is like a lot of the adults are the ones that kind of think they're not as valuable, people that do have personal experience or knowledge around substance use. But again, like reminding ourselves to be in the mind of a college freshman. Medical amnesty programs are a really big one. If I had to pick one, I'd say if your school doesn't have one, try to get your school to have one. It increases the chances that somebody's going to seek help in a medical emergency that involves alcohol or drugs. They decrease serious negative health outcomes, including death. And they also increase the reporting of sexual assaults that involved alcohol or drugs. And so what a medical amnesty program is basically students who call for help in an emergency will not get in trouble for alcohol or drugs by calling the police or by calling for help. And so that's really important because A, you should have that because otherwise people aren't going to call and you're going to have people who die. And B, an important thing that when I was doing the research for this, I was really horrified by was that over 40% of students that are in a university that have a medical amnesty program did not know their school had one. So it's not enough to have a program. Students need to be aware that the program exists, or else it is the same as not having one in terms of them calling for help. And so this is something that it's often included in the DFSCA mandated annual report, or sorry, annual information dump, basically, that your university will give you. But people a lot of times aren't reading that. So like, I remember when I was in undergrad, like they told us about this during orientation, but that's like a 2-day process of you learning maybe 300 things. And you want to make sure that this really sticks. So this is something I would encourage people you have signs for at the health center, or students, like just other avenues of getting this information out to students because it's really important. Another one is brief interventions. I know some people just mentioned Basics and K6, which is 2 really good brief interventions for college students. Basics is brief alcohol screening and intervention. K6 is cannabis screening and intervention. And these interventions are pretty effective. They reduce high-risk alcohol and cannabis use. They reduce negative consequences associated with drug use. And they also have longer-term positive effects. So these, even though they're brief interventions, do influence students' approach to substance use for a longer period of time than you might expect from such a brief intervention. And they also increase the chances that a student will actually seek mental health treatment if needed, because it's like a first point of contact with the health center. I'm seeing a lot of information about Good Samaritan laws. Yeah, that's kind of similar to the medical amnesty, often like lumped in with it as well. And so, yeah, you can call it either one. Good Samaritan is often a bit broader, which I would also say is a good thing. So sober living's on campus. This is like a college dorm or facility dedicated entirely to students in recovery or who are abstinent from drugs and alcohol. And research on these, like there's some qualitative research. Students are saying things like, this has made college possible for me. It also provides a sense of community among peers who don't use drugs, because there's a lot of misconceptions about what % of college students actually do use drugs. Students tend to think that everyone else is just constantly drinking and doing drugs when that's not the case. And so this can give a sense of community to people who have chosen to be abstinent, and give them a sense of like well-being and connection with like-minded peers. It also increases access to mental health treatment, often because these are in conjunction with kind of like behavioral health services. So one example is at Stanford, they have the Well House, which is a residential center for students who are sober. One of the talks coming up from this seminar series actually is from Noel Vest, who used to be over here at Stanford, in large part associated with this center. And so that's pretty exciting. I would definitely attend that. And then others that are increasingly available is naloxone training and distribution. I'm guessing many of you, because of your answers to the harm reduction question, know what naloxone is. In case you do not, naloxone is an opioid overdose reversal agent, which means it will stop an opioid overdose from happening, and it essentially brings the person back. And so these programs for college students are newer in the past like 5 or so years, but it trains students to increase awareness of signs of overdose. It also reduces stigma about people who use drugs. So one of these programs also had like a stigma measure that they asked students before and after. And people had a lot less stigma about people that use opioids afterwards, which was a little bit unexpected for me, but was interesting. And obviously, this would decrease the risk of a fatal overdose. So this is the one at USC. It's in conjunction with the School of Pharmacy. It often is. And when we get to the workshop, I would love to hear if other schools have these and how they're implementing them as well. Also increasingly available is peer-to-peer programs. There was one paper that cited 6 core tenets of harm reduction in the college setting, and peer-to-peer programs were one of those core tenets. And so the idea here is that people who are impacted by these rules and by these policies and by these problems should have a say in making these rules and policies and solving the problems. Peer-to-peer programs also reduce the racial inequities in access to mental health care. So we often see that historically marginalized communities, racial communities, are less likely to access mental health services at the college campus. But if it's a peer-to-peer program, it reduces those inequities by quite a bit. It also reduces other health-related harms that are not related to substance use. And so that would be other behavioral kind of interventions, things like suicide prevention. And these peer-to-peer programs have not been widely implemented for substance use, but there's nothing stopping people from doing that. So one example would be the fireside chat line for psychedelic support. And this is, people can call the hotline while they are, under the influence of psychedelics or after the experience if they need to talk to somebody about just what happened, because not every trip goes to plan. And this would be something also where set, and setting could be incorporated. And drug take-back programs, these are also increasingly available. These are great because they reduce the risk of using excess medication. College students are also at the age where they're likely to get their wisdom teeth removed. I know I got mine out in early grad school, and this was such an interesting interaction I had with the dentist. She asked me if I had any history of substance use problems. I said no, but I have a family history, and I work in substance use, and I don't think you should give me more pills than I need as a general rule. And she's like, okay, great. And then when I left, I had a full bottle of, I forgot what it was now. I think it was Oxy. And it was like 30 pills. And she goes, you should only need these for 72 hours. And you can only take one every 8 to 12 hours or whatever it was. And I had over 20 pills left and I didn't need them anymore. And I was very surprised because we had a conversation about it. And then she still gave me the full prescription. And so I just kept it in my drawer for years because I didn't know what to do with it, right? And so safe drug disposal is a great thing because you don't want unused prescriptions lying around houses. We all know that. It can be pitched as saving the environment because people also flush them. I worked at a treatment center, and every time we found drugs, we would just flush them. That's not great. It's also why we have a huge amount of prescription and non-prescription medications in our water supply. Most of them are filtered out. I don't want to like fearmonger, but it is, if we test the water, there is medication in it. And interestingly for these drug disposals is that about 10% are controlled substances. So about 10% of the things people are dropping in the box are not prescription drugs. They're, illicit substances. And of that 10%, the vast majority are opioids. And so these are, they can be a little drop box. I know USC had it where it was like twice a year. You could just go in and drop your drugs, no questions asked, that sort of a thing, which is great. And last but not least, drug checking. So this is really important because a large part of the reason that we're seeing this increase in overdoses, despite students using less or fewer substances, is that people don't know what's in their drugs. The supply, very simply, is just more dangerous than it was 5 years ago and significantly more dangerous than it was 10 years ago. And so checking drugs for adulterants reduces overdose risk. It increases the ability to track tainted supplies. So if in a 1-week period, everyone is telling you there's fentanyl in these pressed pills, you can alert the community, hey, there's fentanyl in those pressed pills. Do not use those unless your intent is to use fentanyl. It also reduces accidental consumption of fentanyl, but also other substances. There was one study I thought was funny. It's not that funny, but it was kind of funny. It was about students who are using test strips in the college setting, and this group of students that found out that their pressed pills had meth in it, and they were really upset because they had a stigma against people that use meth, and they're like, well, I don't use meth. And then the people testing the drugs were like, well, you have been using meth because this is not the first pill. And like, in a series of pills. And so it also is just nice to know what you're consuming, because again, if you don't have good awareness of how you feel under the influence of a particular drug, you might not know, even if you've repeatedly taken it. So this is from UNM, where I'm currently at, talking about promoting safer drug use. And so the School of Pharmacy is also distributing fentanyl test strips here, which is great. And then on that first slide, I had test strips from DanceSafe. And so you can get them, I believe, for free from DanceSafe, and a lot of state programs also provide them for free to universities. So kind of to sum up here, with harm reduction in the DFSCA in terms of the law, they are in sync. The DFSCA does not stop people from implementing harm reduction programs. 0 universities that have these harm reduction programs have been cited or penalized by the federal government for violating the DFSCA, because it does not violate the DFSCA. So just to recap, the Drug-Free Schools and Communities Act says that institutions have to have a policy that prevents the unlawful distribution or use of substances, but the program requirements that the universities themselves have to have are not prescribed by the government. There's extremely, like, this very wide latitude that colleges have to determine what they want these programs to look like. And they, you can uphold the current laws while also implementing harm reduction based frameworks. So just to highlight some of the universities that have been doing this work, there's a ton, and there's more than are listed on this slide. This is just like a quick Google search of harm reduction colleges. And I'm very curious to know about your universities and what you've all been up to. And so one resource I want to highlight is the handbook I wrote. So this is basically what I just said, but with a lot more stats and details. Thank you, Anthony, for putting that in the chat. And this is a sample of some of the programs that universities have been implementing to make their campuses a safer place for their students. And so with that, I want to have a little bit of time for the workshop session. So you can put these in the chat, you can unmute. I'll also look at the Q&A because I see there's something in there. I'll do that first, actually. But think about some of the answers to these questions about what evidence-based strategies might work best on your campus, who would you need to involve to make the program or policy a reality, and what action could you take today to start work towards implementing these types of programs. And someone asked in the chat, if not for substance use, what have the peer-to-peer programs you've studied been primarily implemented for? So primarily for behavioral health stuff. So they're looking at suicidal intent and ideation. And that was like the primary one. And then another one was, I want to say it was like something like getting vaccinated. It was some like health behavior to promote health and well-being that was like really unrelated to substance use. But the primary bulk of them was suicidal intent and ideation. Great. Yeah, we should get testing on more campuses. Yeah, so in the workshop here, oh yes, we see chats coming in. What, I guess also a good question here would be like, if anyone wants to type in what they know for sure their university is already doing, just to get a better sample for other people in here, because there is a huge gap in terms of what colleges are doing across the country, all the way from like full-on abstinence only to, having access to test strips and naloxone and a sober living house on campus, all at the same university. And so really, I think kind of networking with people at universities who have more programs is beneficial for people who are trying to just get their university up and running, with just like the basic ones like medical amnesty and the Safe Ride programs, which I think are the lowest hanging fruit among the ones that we talked about today. Or if someone has some I did not list, this was not like a fully closed loop here. Oh, yes. Thank you, Gwen. And what university are you with? Western Washington. Great. Yeah. So if other people want to type in the chat, like universities that they are associated with or have been associated with, or just happen to know a lot about for some reason, and what they have. The substance-free housing is always very interesting to me because the concept is that all student dorms are substance free because that's usually a rule. But the knowledge that they are not is kind of what helps people get to the next step of having it actually be a dedicated space for students in recovery. Oh, Tufts, great. What is FTS from Tufts?
Fentanyl testing strips.
Oh, thank you. I should have put that together. Ah, UBC. These are great. I hope other people are also scrolling through and seeing I'm seeing a lot of very similar ones pop up, which is great. I'm looking for one I've never seen before. I haven't found that yet. Oh, for Nathan from WVU, you're saying get inclusive and switching to vector. Is that related to an app or what are those? I'm happy to see a lot of fentanyl test strips. This was something when I was writing the handbook, they made us take out. We were actually working with the Department of Education to get them to sign off on it so that they could say, like, we could distribute this nationwide to colleges and universities and say, like, here's what you should be implementing at the bare minimum. And they said because of the legal issues about fentanyl test strips at the federal level, that they just like refused to sign off on that. And we were really confused about that because they are one of the most prevalent ones that people use, and they're also really cheap and easy to deliver. And so it felt a little frustrating to see that. CU Boulder has everything. That's great. Oh, this is a good question from Jessica. Other than alcohol EDU, are there other programs that you recommend for, the student body? I don't know. Basics and K6 are different than the actual program. If others have a response to that, please put that in the chat as well. It's very hard for me to keep up with this at this point. It's very good. You can also unmute if you feel so inclined. Oh, that's a good question. Somebody asked for universities that have a small graduate, postgraduate, like only 2,000 students, and they don't have a recovery program, what would you recommend? I would first of all say that if you have 2,000 students, you definitely have some students in recovery. And so one thing that was really cool at UCLA when I was there was that we just have like a student-led 12-step-ish group. And so if you don't have a campus recovery program, I would first of all try to like figure out like if there's a way to get the students to kind of lead it. And then in line with that is you can be a sponsor for a Students for Sensible Drug Policy chapter. So SSDP, which if you click the link for this handbook, is the organization that you'll see the webpage for. And it's very easy to start a chapter at the university. You just need students that have an interest in drug policy. And then the chapters can look very different from each other in terms of what their goals are. But a lot of their goals are directly related to campus level or even like community and state level legislation to improve substance use, basically treatment and care. And so, yeah, those would be some things I would recommend. If other people have recommendations for Errol as well, happy to hear them about like if you don't have a campus recovery program and you have a small student body, what are some things you can do? I will also say, unrelated to the campus recovery program, all of these harm reduction policies could apply at a school with 2,000 or 20,000 or 50,000 students. They're not limited by like number. So there was something called Roar House. That's fun. Oh, from GW, the liquid death. That is always the canned water, I think, is such an interesting thing that it got as big as it did. Oh, Vector owns alcohol EDU. Thank you, Nathan. Just reading. Cool. Oh yeah, JED Foundation is also a really great resource. Gwen mentioned in here for like getting help with finances or grants or even just like web pages of support on how to do these things. JED Foundation is a great resource. A lot of schools have a lot. This is really, I'm very pleased with this. I often have talked to, the last time I gave this presentation was to college lawyers and attorneys, and there was a lot of questions about the liabilities of these. And then the response from some of the panelists was the liability of not doing these seems a lot worse, if you know that they work for reducing harms. You not having the resources is not a good move. And so, oh, the nicotine. I haven't heard that one before. That's going to become, I think, more important. We were chatting before the session started about, college students and substance use. And vaping is like obviously very prevalent among Gen Z, and that includes college students. And I just, in teaching, like interact with students who are just vaping in class, and it's very different than when I was in school. Is like that was not a thing. And so I think the nicotine quit kits and nicotine cessation is going to become more of a need for this particular community. And also, I've been alerted to the fact that you all actually cannot unmute. So apologies for repeatedly asking you to do that which you cannot do. And then Nathan just asked if other schools have had success working with parents. So other people feel free to type in the chat to answer that as well. But I've done some work with Joseph Labrie and Eric Peterson on the transition from high school to college and involving parents in that, in these like educational formats and programming. So I'm going to type in here the name, Joe Labrie. Oops. It's because like he does a lot of work in this space with the parents specifically. And Eric Peterson as well, but not quite as much as Joe Labrie. Because they do work with parents on these educational programmings on like, especially in terms of like, there's a percentage of college students that come to college that have never talked to their parents about drugs or alcohol in their lives. And they're probably not going to start doing that just because they're in college now and out of the house. And so getting the family involved and at least being open to having conversations about it can be really important, because students are still, on the most part, pretty young and should have access to parental support. Oh, yeah, Espert, that's one we haven't talked about a lot. That's a good one as well. And then I just got reiterated the question about the universities that have like a small student population and don't have a recovery program. If anyone wants to add anything to that, again, feel free. But again, yeah, these harm reduction programs are useful for any size student body. And I would recommend like having some sort of mutual support health group by and for students, or even looking into opening an SSDP chapter, Students for Sensible Drug Policy. Oh, that's a great one, Zachary. They have a car ride home booklet for families to talk about the transition and behavioral health issues as they arise from high school to college. I think that's really important. And if anyone has links to the things that they're chatting about as well, feel free to put those into the chat so that people can kind of like search for resources. And then if you noticed when you typed in things into the chat that yours was very short, like maybe your university only had one or two, think about like what you could do as a next step, who you could talk to either in the university health administration. You could talk to people in the School of Pharmacy if it's about like Narcan training. I do know that the health center is often involved, and the pharmacy school. And then you'll also want to get, like, a lot of universities will have specifically a substance use type health center. So I know at University of New Mexico, we have COSAP, which is our like substance use policy and intervention division of the health program for students. And so they're definitely who we want to get in contact with and whenever we want to implement these sorts of things. And so being sure to like kind of like do some digging around the university and see who's responsible for making these decisions. And one other thing I would like to say is like figure out if your school is actually collecting this biannual report data for the, like, as mandated by the Drug-Free Schools and Communities Act, because that data could be really useful. And if it's not asking the kinds of questions you want it to be asking, you might be able to get in contact with whoever's responsible for collecting and analyzing that data in order to make sure it's actually addressing like substance use related harms, things like DUIs or overdose rates or sexual assaults on campus. This buffs discussed from Alyssa at CU Boulder seems very interesting, especially for, I'm forgetting the name of the person who asked about the small campus community earlier. It seems like a really good peer-to-peer program for people to just talk about substance use and harm reduction and resources. I think that could be a really good kind of like lower barrier to implement sort of program. Somebody posted about being a representative of a Greek organization and knowing what the university is doing to see where you align with harm reduction programming. At USC, the Greek community was actually the primary driver for a lot of harm reduction efforts on campus. So there were people formerly in Greek life that founded TACO, the Trojans Alliance for Combating Overdose, or I think something like that. And they got access to test strips because the university wouldn't. And so they just go out to the Greek, all the like Greek communities and hand out test strips at places where people are more likely to be interacting with like higher risk substances, essentially. And you also, oh, you advise a student group at UNM. Great. Yeah, so if you want to know more about like what specifically UNM offers, we can look at COSAP, which is COSAP, and I'm bad with acronyms. I can't remember what it stands for. But if you want to chat with me after, one of my colleagues, Randall, like co-runs COSAP, and UNM CASA, where I work, is a big element as part of that as well. And so you can talk to me for what we can do at UNM to improve access for student organizations to some of these harm reduction strategies. That's a really good question, Linda. Is anyone helping Greek organizations do peer education? I do think a lot of misinformation comes from peer education. So training people on peer education correctly is probably a really low barrier, high impact kind of an event. Does anyone have an answer to that? I don't know if anyone is specifically training Greek organizations to do peer education around substance use. Give you a moment to respond in there. Oh, and then I see also to the host, somebody wrote, reaching out to the institution's Clery Act manual, or sorry, mandated annual security report. Yes, it is most likely whoever's responsible for collecting the information about the, every year universities have to send information to the federal government about crimes committed on campus. And that's part of the Clery Act. They are going to have the data you need. And so that's definitely figuring out who is your institution's Clery Act kind of like point person would be really good to include as well. Oh, and Julie said that they train people, I'm assuming this was about the Greek life question, on bystander intervention. That's important as well. And I would also argue that making sure they're aware of the Good Samaritan laws and the medical amnesty as well, because people that suffer consequences from substance use are very rarely alone in the college setting, and people could have been calling for help and often are afraid to. Oh, and then somebody just put a thank you, Logan, for the peer education program at Oklahoma. That's like exactly what they wanted. And I realize we're running out of time as well.
Well, I just want to say a big thank you to Dr. Christie. Thank you for sharing of yourself and your expertise. I am going to just share a couple of housekeeping slides. I am going to just share briefly your contact information if folks are interested in reaching out. You have access to the session materials. Today's session has been recorded and you can expect to see it uploaded to our website within 3 business days. Just as a reminder, our fourth session in our Learning Collaborative will be taking place next week on April 3rd with the SAFE Project team. The session is titled Fostering Community Wellness, a Collaborative Approach to Harm Reduction in Collegiate Setting. Our next water cooler chat is taking place on April 9th and will be focusing around preparing students to leave for campus for the summer. And our next free webinar will be taking place April 18th and will be focusing on the impacts of the justice system's involvement on college students in recovery. And of course, we would love to see you all joining us for the 2024 national meeting taking place at the end of July and the beginning of August. Again, a big thank you for Dr. Christie and their very informative session. And just again, a reminder that today's session has been recorded and you can expect to see the session recording and the session slides added to our website in about 3 business days. Thank you again, everybody, and I hope you have a great rest of your day. Take care all.